AIDS, or acquired immunodeficiency syndrome, is a serious condition caused by the human immunodeficiency virus, or HIV. This virus attacks the body's immune system, which is our defense system against infections. Imagine your immune system as an army protecting a castle. HIV acts like spies, weakening the army from within, making the castle vulnerable to attacks. When the immune system is weak, it cannot fight off infections effectively. This makes individuals with AIDS highly susceptible to a range of opportunistic infections, meaning infections that wouldn't typically affect a healthy person. Burning urine itself is not a direct symptom of AIDS. Instead, it's often a sign of a urinary tract infection, or UTI. UTIs occur when bacteria enter the urinary tract, causing inflammation and discomfort. Think of your urinary tract as a pathway. When this pathway is irritated by bacteria, it can feel like a burning sensation, especially during urination. Because AIDS weakens the immune system, individuals with this condition are more prone to developing UTIs. Their bodies struggle to fight off the bacteria, leading to more frequent and potentially severe infections. Diagnosing AIDS involves a blood test that detects the presence of HIV antibodies. These antibodies are produced by the body in response to the virus. Early detection of HIV is critical for starting treatment and preventing the progression to AIDS. Urinary tract infections are typically diagnosed through a urine test. This test can identify the presence of bacteria or white blood cells in the urine, indicating an infection. If you experience burning urine, it's crucial to consult a healthcare professional. They can determine the underlying cause and recommend appropriate treatment. Recognizing the symptoms of both AIDS and UTIs is vital for prompt diagnosis and treatment. Early detection can significantly improve the effectiveness of the treatment and the overall prognosis for the patient. Understanding the differences and similarities in the symptoms of these conditions can help in seeking timely medical advice. Early symptoms of HIV infection can be flu-like, including fever, sore throat, and fatigue. These symptoms often appear within 2 to 4 weeks after the virus has entered the body and can last for several days to weeks. It's easy to mistake these symptoms for a common cold or flu, which is why many people may not realize they have been infected with HIV. As the infection progresses to AIDS, more severe symptoms may arise, such as rapid weight loss, persistent diarrhea, and recurring infections. These symptoms indicate that the immune system is severely compromised, making the body more susceptible to opportunistic infections and certain cancers. It's crucial to monitor these symptoms and seek medical attention if they persist or worsen. UTIs typically manifest as pain or burning during urination, increased frequency of urination, and a feeling of urgency to urinate. These symptoms are caused by the inflammation of the urinary tract, which can be due to bacterial infection. It's important to note that while these symptoms are common, they can also be indicative of other conditions, so proper medical evaluation is necessary. The urine may also appear cloudy or have a strong odor. This change in appearance and smell is often due to the presence of bacteria, blood, or pus in the urine. If you notice these changes, it's important to collect a urine sample and consult a healthcare provider for a proper diagnosis and treatment plan. If you experience any of these symptoms, it's essential to consult a healthcare professional for diagnosis and treatment. Early intervention can prevent complications and improve outcomes. Regular checkups and being aware of your body's signals can help in maintaining good health and catching any issues early on. Don't hesitate to seek medical advice if you feel something is off. Section 5. Treatment options, addressing the root cause. While there is no cure for AIDS, antiretroviral therapy, or ART, can significantly slow down the progression of the virus. This treatment involves taking a combination of HIV medicines every day. These medications work together to control the virus in different ways, making it harder for the virus to multiply and cause damage to the immune system. By adhering to the prescribed RT regimen, individuals living with HIV can maintain a higher quality of life and reduce the risk of transmitting the virus to others. Regular monitoring and consultations with healthcare providers are essential to ensure the effectiveness of the treatment and to make any necessary adjustments. ART works by reducing the amount of HIV in the body, allowing the immune system to recover and fight off infections more effectively. This is crucial because a weakened immune system makes the body more susceptible to opportunistic infections and certain cancers. By keeping the viral load low, ART helps to prevent these complications and supports overall health. It's important to start treatment as soon as possible after diagnosis to achieve the best outcomes. Patients should also be aware of potential side effects and communicate with their healthcare team to manage them effectively. Treatment for urinary tract infections usually involves a course of antibiotics to eliminate the bacterial infection. The type and duration of antibiotic treatment can vary depending on the severity of the infection and the patient's medical history. It's important to complete the entire course of antibiotics, even if symptoms improve before the medication is finished, to ensure that the infection is fully eradicated and to prevent the development of antibiotic-resistant bacteria. In some cases, additional tests may be needed to identify the specific bacteria causing the infection and to choose the most effective antibiotic. Drinking plenty of fluids is also important to help flush out the bacteria from the urinary tract. Staying well hydrated can help to dilute the urine, making it less irritating to the bladder and urethra. Water is the best choice, but other fluids like herbal teas and clear broths can also be beneficial. Avoiding caffeine and alcohol is recommended, as these can irritate the bladder and potentially worsen symptoms. In addition to drinking fluids, some people find relief from urinary symptoms by using a heating pad on the lower abdomen or back to ease discomfort. It's crucial to follow the recommended treatment plan provided by your healthcare provider to manage both conditions effectively. This includes taking medications as prescribed, attending follow-up appointments, and making any necessary lifestyle changes. For those with chronic conditions, ongoing management and regular checkups are key to maintaining health and preventing complications. Open communication with your healthcare team can help address any concerns or questions you may have about your treatment. By actively participating in your care, you can take important steps towards better health and well-being. Section 6. Preventing AIDS and urinary tract infections. This section will delve into the crucial steps and practices that can help individuals protect themselves from these serious health issues. Preventing AIDS primarily involves practicing safe sex by using condoms consistently and correctly. Condoms act as a barrier that prevents the exchange of bodily fluids, which is the primary way HIV is transmitted. It's important to use a new condom for each sexual encounter, and to follow the instructions on the packaging to ensure they are used properly. It's also essential to avoid sharing needles. Sharing needles can transmit HIV and other blood-borne infections. If you use injectable drugs, always use a new sterile needle and never share it with others. Many communities offer needle exchange programs to help reduce the risk of infection. Regular testing for HIV is another critical preventive measure. Knowing your HIV status helps you take steps to protect your health and the health of your partners. If you are sexually active or engage in activities that increase your risk of exposure, such as sharing needles, it's recommended to get tested at least once a year. Early detection can lead to early treatment, which can significantly improve health outcomes. Preventing UTIs involves practicing good hygiene, such as wiping from front to back after using the toilet. This simple practice helps prevent bacteria from the anal region from spreading to the urinary tract, which can cause infections. Additionally, it's important to wash your hands thoroughly after using the bathroom to further reduce the risk of spreading bacteria. Urinating after sexual activity is another effective way to prevent UTIs. Sexual activity can introduce bacteria into the urinary tract, and urinating helps to flush out these bacteria before they can cause an infection. It's a good habit to develop, especially for women who are more prone to UTIs. Drinking plenty of fluids, particularly water, can also help flush out bacteria from the urinary tract. Staying well hydrated ensures that you urinate more frequently, which helps to keep the urinary tract clean. Aim to drink at least 8 glasses of water a day, and more if you are physically active or live in a hot climate. By adopting these preventive measures, individuals can significantly reduce their risk of contracting HIV and developing UTIs. Prevention is always better than cure, and by taking these steps, you can protect your health and well-being. Remember, staying informed and proactive about your health is the key to a long and healthy life. Section 7. Living with AIDS. Importance of early detection and treatment. Early detection and treatment of HIV are crucial for improving the quality of life for individuals living with AIDS. With the advancements in ART, people with HIV can live long and healthy lives. Regular medical checkups, adherence to medication, and a healthy lifestyle are vital for managing the condition effectively. Remember, a diagnosis of HIV is not a death sentence. With proper care, support, and access to treatment, individuals with AIDS can lead fulfilling lives. Section 8. The interplay of physical and mental health in AIDS. Living with AIDS can impact mental health, leading to feelings of anxiety, depression, and stigma. It's crucial for individuals with AIDS to have access to mental health support and counseling services. Addressing mental health concerns is as important as managing the physical aspects of the condition. Support groups and online resources can provide valuable information, coping mechanisms, and a sense of community for those navigating the challenges of living with AIDS. Section 9. Seeking support and information. If you or someone you know is affected by AIDS, numerous resources are available to provide support and information. Organizations like the Centers for Disease Control and Prevention and the World Health Organization offer comprehensive information on HIV/AIDS, prevention, testing, and treatment. Remember, you are not alone. Reaching out to healthcare professionals, support groups, and trusted resources can provide guidance, care, and a sense of hope in managing AIDS and its associated challenges.